an epidemiologist at the University of Ottawa. Good morning.
Good morning to you.
What was your reaction when you heard that this monkeypox virus was cropping up now in Montreal?
Two things. One is that I remember reading a paper many years ago that how monkeypox is one of the candidates for the next global pandemic, which is kind of scary. And the second thing is I remember that in 2003, there was an outbreak in the USA of about 70 people, and nothing bad happened there because we have the public health tools to contain a virus like monkeypox.
I'm seeing these images, though, on repeat on the news, and it's quite horrifying, to be honest with you. But how would you describe what monkeypox is?
It's in the smallpox family, related, very closely related to smallpox, which is why it's scary. So the experiences can be similar, but it's not nearly as contagious or as lethal as smallpox. So it's a bad experience for many people, but for most cases, it resolves on its own. It's just that a proportion of people will suffer, and a fairly large proportion can die based upon experiences in Africa.
What symptoms should people be on the lookout for?
First, about a fever. That's pretty typical. After about 1 or 2 weeks after first exposure, then a few days after the fever, the rash, the famous smallpox-like rash, which can last 1 to 2, even 3 weeks. Again, most cases resolve on their own. It's just that a certain number require treatment.
Do we know how it's transmitted?
Yeah. It's mostly by touch, touching someone's broken skin, their open sores, maybe by breathing on each other. So we know that monkeypox virus can reside in those large respiratory droplets that we breathe out that fall to the ground within 1 or 2 meters. There is some evidence that a proportion of it might be aerosolized, which means the threat of an airborne virus is present. It's unclear how common that is, though. And fomites, that thing we're afraid of early in the COVID pandemic, which turned out not to be a big deal. It is a big deal for monkeypox. So imagine someone has an open sore and they sleep in bed sheets, then you sleep in the same bed sheets, and now you're touched the sheets that touch their sores. You're probably going to get infected. So touching common surfaces can be an avenue of infection as well.
In reading some of the coverage of what's happening in Montreal, there seemed to be some suggestion that sexual contact was part of this story. Is that your understanding?
Yeah, so think about what sexual contact means. You're face-to-face very often, you're sharing bed sheets, you're touching individuals, person-to-person contact. All of that is encapsulated within the sexual experience. So it's not surprising that you can get it through sexual contact. Doesn't mean this is a sexually transmitted infection. Maybe if you want to be a stickler for definitions, but there's Ebola virus found in semen, as Zika as well. Does that make Zika and Ebola a sexual disease?
Right. What are the challenges for doctors in identifying cases, Raywat?
Not nearly as bad as with things like COVID, because the symptoms are fairly obvious, the fever followed by that telltale rash. But in mild cases, that fever can be discounted or unacknowledged and not even noticed. And so there is the small threat of people walking around being infected, not acknowledging their symptoms and being contagious that way. So we have to be on the lookout for an unexplained fever, and especially that rash, which is usually on the face and the extremities.
We heard officials say that Montreal is putting in protective measures to stop the spread or slow the spread. What could help do that?
Well, here's some good news. There's a lot of good news here, by the way. Among them is that this is happening at the tail end of the COVID experience. So we already have the measures in place to contain a respiratory virus. So mask wearing, distancing, minimizing contact with common surfaces, all those things work extraordinarily well. My colleague Diego Bassani had tweeted that if you're following COVID protocols, you are not going to get monkeypox. And he's absolutely right. So those things work all the time.
Was the case, though, of someone from the U.S. traveling to Montreal and then going home with monkeypox. Are there other cases cropping up outside where there normally is at this time?
Well, what's normal? Normal is usually Central and West Africa. So anything outside of that is abnormal. We have cases now in Italy, Sweden, Portugal, Spain, the UK, and now USA and Canada. So it seems to be spreading. Now, remember, there's good news here. Number one, good news is that there are two versions of this disease. The less serious one seems to be the one that's spreading. Number two is we have a vaccine. Number three, we have treatments. So this is not a reason to panic, to my mind, at least not yet.
Tell me more about the vaccine for this.
Well, the smallpox vaccine that many of us of a certain age had as children works It's been updated back in 2019, I think. So it works about 85% efficacious against monkeypox. The vaccine you got as a kid, if you're of a certain age, will not protect you at this point. It needs to be updated. But if you've been exposed to monkeypox, getting the vaccine will reduce the chances of getting a symptom even after exposure. So we always have that vaccine in our back pocket. Mind you, it is a live virus vaccine, so it is has a bigger risk associated with it than the current COVID vaccines. So people who with immunocompromised experiences probably should be advised not to take that vaccine.
No, it struck me, Raywat, that it's possible that we, all of us, or many of us, maybe not epidemiologists like you, but regular folks, may be particularly nervous about viruses like this because of COVID. Is that possible?
It's totally possible. We've all been primed to be a little panicky about new diseases, but there are diseases around us all the time, and they make the news now because, it's a sensitive issue. At the same time, I don't want to dissuade people from being cautious and concerned because we're in a new era of pandemics, it seems, as we encroach upon new territories and people travel more widely and so forth. So this might be a new norm, experiencing infectious threat on a regular basis. But again, we have the public health tools to combat this sort of thing.
Raywat, thank you very much for your time this morning.
It's my pleasure. Thank you.
That's Raywat Deonandan.